Welcome to Module 6. In this video, you will learn about local health professional contact details. This is a hybrid learning curriculum for migrants. Let's get started. Introduction. According to statistical data from the European Commission, in 2022, the number of immigrants was 6.98 million. With the number of displaced people across the world tripling in the last decade, the number of people attempting to reach Europe is not expected to slow down anytime soon. This provokes concern among both the population and the leaders of European countries. These increased numbers are inevitably going to put a strain on health systems. Beyond the numbers, the real challenge is the change in the composition of the European population due to this influx. Indeed, this demographic pressure leads to a growing ethnically diverse population in many European countries, which has more than ever different healthcare needs, languages, traditions, expectations, and previous levels of care. This higher level of diversity is likely to increase health inequalities that might challenge healthcare systems if not addressed. Introduction: Learning Outcomes. By the end of this module, trainees are expected to gain knowledge, know the public health policies of the European Union, recognize the different types of access systems to the public health systems of the European Union, know the access systems to the public health systems of the consortium member countries, know the contact details for access to health professionals from the consortium member countries, know the procedure to be carried out to access the public health systems of the consortium countries. Know other accesses to private health systems. Discuss the importance of the right to access to public health. Identify barriers to accessing health services for migrants and strategies to address these barriers. Skills. Apply principles of cultural competence to interact and assess the needs of diverse immigrant populations. Adaptation to the requirements of access to public health services. Facilitate access to public health services. Modify communication strategies to establish good communication with health professionals. Modify strategies to eliminate barriers to access public health services. Obtain informative health education about access to health systems and resources available for migrant people and communities. Offer advice and help to community and culturally related members. Collaborate effectively with other professionals, including social workers, medical providers, interpreters, and community leaders, to coordinate comprehensive care for migrant clients. Communicate respectfully and professionally across disciplines, recognizing the unique experience and perspectives of each team member. Attitude. To adopt an attitude that allows feedback about the procedures for accessing the public health systems of the host country. Engage in ongoing self-reflection and introspection to identify and challenge personal assumptions, stereotypes, and biases that may influence interactions with healthcare professionals. Promote an attitude of adaptability and flexibility to respond to the diverse needs, preferences, and communication styles of health professionals. Accept cultural differences as opportunities for learning and growth, instead of seeing them as obstacles or challenges to overcome. Cyprus Local Health Professional Contact Details. Third country nationals or stateless persons arriving in Cyprus are informed by personnel at the Reception and Identification Centres, RIC, or mobile units about their rights and obligations. This information is provided in a language they understand. The United Nations High Commissioner for Refugees, UNHCR, and other organisations may also provide this information. The initial medical examination and psychosocial support are conducted to assess the needs of incoming individuals. This screening helps identify those who may require immediate medical assistance or special support. Reception and identification. Third country nationals or stateless persons are subject to reception and identification procedures. They may be restricted within the reception and identification centres based on decisions made by the relevant authorities. Registration and medical examination. Registration, personal data, both basic and additional, are registered in the information system. Verification of identity and citizenship, including the collection of biometric data, Eurodac, and a face photo. Medical examination, conduct medical examinations and create a medical record. Provide care for vulnerable groups and psychosocial support. Reception conditions, accommodation and basic needs. Reception conditions include accommodation facilities that provide basic needs such as food, hygiene products, and essential services. Vulnerable groups, such as unaccompanied minors, pregnant women, and people with disabilities, receive special attention and support. Access to services. Refugees and asylum seekers have access to various services, including healthcare. Medical services are provided to ensure the well-being of individuals. Since June 2019, a General Health System, GHS, has been in place in Cyprus. The new system provides healthcare through the concept of the personal general practitioner, GP, in the community, who serves as a point of contact for referrals to specialized doctors. Health services are provided through a network of private doctors, diagnostic centers, and pharmacies. In addition, inpatient care is also provided by certain private hospitals that have joined the new healthcare system. Health services are offered almost exclusively within the framework of the new healthcare system for the majority of Cyprus's population, Cypriot citizens, EU citizens, and eligible non-citizens. Education. Primary and secondary education is mandatory and free for children up to 15 years old. Greek language courses are available to help with integration. Employment. After 1 month from submitting an asylum application, individuals can work in certain sectors. Registration at the nearest labour office is required. Social assistance. Asylum seekers without income can apply for social assistance at the local welfare office. Asylum Service of the Ministry of Interior description, governmental agency responsible for managing asylum applications and ensuring the protection of refugees. It processes asylum claims, conducts interviews, and makes decisions on refugee status, adhering to both national and international laws. Address: 70 Arch Makariou Threed Avenue, Euphemia House, 1077 Nicosia. Telephone 224525. Email info@asylum.moi.gov.ci. Website hpr.moi.gov.ci. Moi Asylum, Asylum Service NSF District Immigration Police Officers. Description: regional units under the police force are responsible for immigration enforcement and control. They handle visa applications, residence permits, immigration enforcement, and compliance, overseeing the entry, stay, and regulation of foreign nationals in the country. Nicosia, 6 Agamemnonos Street, Engomi 2411, Tel 22 80233 Larnaca, 75 Piale Pasa, 6027 Mackenzie Avenue, Tel 24 804242 Limassol, 23 Franklin Roosevelt, Zakaki, 2nd floor, Tel 25 805200, Paphos, Corner Caningos and Eleftherio, Venizelos. Nicolau Court, 2nd floor, Tel 26 806200, Derinia, 83. Eleftheria Street, Tatalos Building, 1st floor, Tel 23 803289. United Nations High Commissioner for Refugees. Cyprus description: protects and supports refugees, displaced communities, and stateless people, ensuring their rights and providing assistance for their safe, dignified lives and solutions. Telephone: 22 385 943 22 359057. Email cypina@unhcr.org. Website UNHCR Cyprus. UNHCR.org. Cyprus Refugee Council CIRC. Description: provides support, protection, and advocacy for refugees and asylum seekers, assisting with legal aid, integration, and ensuring their rights and well-being in Cyprus. Telephone: 22 5959. Email info@cyrefugeecouncil.org. Website Cyprus Refugee Council, http://www.cyrefugeecouncil.org. Kisa Migrant and Refugee Centre. Description: offers support, advocacy, and legal assistance to migrants and refugees, promoting their rights, integration, and combating discrimination and xenophobia. Telephone: 22 878 181. Email info@kisa.org.ci website. KISA, ATPSA, www.kisa.org.ci. Caritas Cyprus Migrant Centre. Description: supports migrants and refugees by providing essential services, advocacy, and integration assistance, promoting their rights and well-being within Cypriot society. Telephone 22 662606. Email caritascyprus.migrants@gmail.com. Website Caritas Cyprus. HTS www.caritascyprus.com. Emergency Services Cyprus, Red Cross Society. Description: provides humanitarian aid, emergency response, health services, and support to vulnerable populations, promoting humanitarian values and improving lives across Cyprus. Telephone 22 66 955. Email admin@redcross.org.ci. Website Red Cross Cyprus. www.redcross.org.ci. Cyprus. Stop trafficking. Description: combats human trafficking through advocacy, support services, and awareness campaigns, aiming to protect victims' rights and eliminate trafficking in Cyprus. Hotline 97 853767. Email cyprus.stop.trafficking@gmail.com. Website Cyprus Stop Trafficking. https://www.cyprusstoptrafficking.webs.com. Hope for Children. CRC Policy Center. Description: supports and protects children's rights, providing services, advocacy, and research to improve the well-being and development of children in Cyprus and internationally. Telephone 22 103234. Email info@ncrcpc.org. Website https://ncrcpc.org.in. Greece Local Health. Professional contact details. Third country nationals or stateless persons are informed by the Information Provision Unit of the Reception and Identification Centre, or by personnel of the Hellenic Police, or the Coast Guard of the Hellenic Coast Guard, or the Armed Forces, in a language they understand, of their rights and obligations at the point of reception. The United Nations High Commissioner for Refugees, UNHCR, and the International Organization for Migration may also inform them. The Medical Screening and Psychosocial Support Unit, staffed by EOD personnel, conducts the initial preliminary medical examination and identifies those in need of immediate medical assistance. The system of diagnosis and immediate identification of illness will be used to assess and address the medical needs of the population of undocumented incoming third country nationals, and to identify cases that may require special assistance. Reception and identification third country nationals or stateless persons are subject to the reception and identification procedures, being in a regime of restriction of their freedom within the Centre of Reception and Identification by decision of the Director. Registration and medical examination. Registration of personal basic and additional data in the information system of ELIS. Application first reception. Identity and citizenship verification, biometric data for Eurodac 1, 2, and 3, and face photo. Medical examination, medical examinations, medical record. Care for vulnerable groups, provision of psychosocial support. According to Presidential Decree 106, Government Gazette A. 255-2312-2020, the Reception and Identification Service functions at the level of the General Secretariat and has as strategic objectives to coordinate the organization and operation of the central and regional reception and identification services, identify the needs for the establishment and expansion of reception centres and accommodation structures, coordinate the activities of the reception and identification services with the activities of the other services of the Ministry, and effectively conduct reception, identification, and temporary residence procedures of third country nationals or stateless persons entering the country without the standard legal processes. RIS consists of the following organic units: the Directorate of Reception and Identification Centres, RIC, and the Closed Controlled Access Centres, CCAC. the Directorate of Northern Greece Facilities, the Directorate of Southern Greece Facilities, the Directorate of Administration Support, Independent Department for Emergency Response, which reports directly to the Director of RIS, the Directorate of RIC, and CCACI, the Directorate of Reception and Identification Centres, RIC, and Closed Controlled Access Centres of Islands, CCAC, has the operational objective to plan, direct, monitor and control the activities, and to ensure, in collaboration with the Support Directorate and the competent General Directorates of the Ministry, the necessary conditions for the effective implementation of the responsibilities of the RIC, the accommodation structures of asylum seekers located in the Aegean Islands, and the CCAC contact head of the Directorate of RIC and CCACI, Thomas Lekakos, 196-198 Thevon Avenue, Ag Ioannis Rentis, 18233, Keranis Building, Athens, Douanatways, Sunchanteintu, Noimi Twain Days, 90 in Ease, Rees Derrixe Migration Gov GR. The Directorate of Northern Greece Facilities. The Directorate of Northern Greece Facilities and the Directorate of Southern Greece Facilities are part of the accommodation structures of asylum seekers of the whole of Greece except the structures located in the Aegean Islands. The Directorate of Structures of Northern Greece has as operational objectives to plan, direct, monitor and control the activities of the structures of Northern Greece and to ensure, in cooperation with the Support Directorate and the competent General Directorates of the Ministry, the necessary conditions for effective function of the structures. Contact Head of the Directorate of Northern Greece Facilities, Vasiliki Dimitriadi, 196-198 Thevon Avenue, Agenisi Ioannis Rentis, 18233, Keranis Building, Athens, 213-162-9819, 9821 Fries Dar Nephew Migration Gov GR, the Directorate of Southern Greece Facilities. The Directorate of Structures of Southern Greece has as operational objectives to plan, direct, monitor and control the action of the structures of Southern Greece, and to ensure, in cooperation with the Support Directorate and the competent General Directorates of the Ministry, the necessary conditions for effective operation of the structures. Contact Head of the Directorate of Southern Greece Facilities, Triantaphilia Ipsa Alexi, Thivon, 196-198, Agsei Ioannis Rentis, 18233, Keranis Building, Athens, 213, 162 9828. 9834 Eris Dia FU Migration de Gov. The Directorate of Administration Support. The Support Directorate, previous Central Administration, has as operational objectives to design, implement and supervise programs and actions aimed at fulfilling the country's obligations as defined by national and EU hosting legislation, and b. ensure the necessary conditions for the efficient operation of the whole of RIS, in cooperation with the competent General Directorates of the Ministry and other competent services. Contact Head of the Directorate of Support, Evangelia Christaki Thivon, 196-198, Agea Ioannis Rentis, 18233, Keranis Building, Athens, 213-162-9842, 213 9843 RIS Dar Migration Gov GR. Italy Local Health Professional Contact Details. If you are a foreign citizen legally present in Italy, you can access the National Health Service, SSN, in different ways depending on the reason for your stay. If you are temporarily present for a period of no more than 90 days, e.g. as a tourist, you can take advantage of urgent and elective healthcare services upon payment of the relevant regional rates. There is no registration with the SSN except for students and au pairs. If you have a regular residency permit, you can register with the SSN by contacting the ASL, Local Health Authority, of your municipality of registered residence. Or, if you are not yet a resident, the municipality of your actual place of residence indicated on your residency permit. Registration with the SSN allows you to choose a general practitioner entered in the ASL registers, with the consequent attribution of 4 credits recognizable for the purposes of the integration agreement. Healthcare is extended to your dependents who are legally residing in Italy. In order to have access, upon arrival in Italy, to healthcare assistance from the Italian National Health Service, you must have an STP code, Straniero Temporaneamente Presente, temporarily resident foreigner, which allows you to take advantage of urgent and essential care, such as access to the emergency room, vaccinations, and the prescription of clinical examinations, specialist visits, and medicines. The STP code is issued by public health facilities with the declaration of your personal details. Useful contacts, Fartiliet 12, a single emergency number valid throughout Europe. By calling it in Italy, you can reach the Carabinieri's emergency service, which, if necessary, will forward the call to the most appropriate body. 113. The Italian State Police offers a similar public rescue service. 115. Fire Brigade. The emergency numbers, it should be emphasized, are active 24 hours a day and always free of charge. They can be reached even from mobile phones without credit, and in some cases even without a SIM card. Poland Local Health Professional Contact. Details: the medical screening of undocumented third country nationals is held after crossing the external border. The brief checks allow for early identification of potential health needs among refugees. Individuals entering the EU without fulfilling entry conditions undergo compulsory health checks as part of the new pre-entry screening procedure. Refugees who do not speak Polish or English should have access to interpreters to facilitate communication with healthcare providers, e.g., Somali or Tigrinya. Reception and identification. Third country nationals or asylum seekers are subject to the reception and identification procedures. They might be transferred to the restricted refugee camps, usually for men, or hospital for further treatment if their condition is severe. Registration and medical examination. Registration, identity and citizenship verification. Medical examination, medical examinations, medical record, care for vulnerable groups, minors, pregnant women or with children, provision of psychosocial support, reception conditions, accommodation and basic needs. Refugees and asylum seekers accommodated in refugee camps are entitled to free accommodation, meals and access to healthcare system. The contact to doctors are available. In practice, the needs are not fully met. People with refugee status or subsidiary protection are entitled to a range of rights and support, including both cash and material assistance, called an Individual Integration Programme, IPI. The annual IPI consists of cash benefits, depending on, among others, on the size of the household, health insurance, free Polish language learning, specialist assistance from a social worker. Key contacts and resources organizations, institutions offering assistance. WEDEN, Narodowy Fundusz Zdrowia, National Health Fund. Description: 24/7 phone line of the National Health Fund in Polish and Ukrainian. Information on where to find medical help. Adres: Rakowiecka 263 02528, Warszawa. Telephone +31 900 9 website https://nfz.gov.pl2 Grupa Granica Border Group. Description: non-governmental organization and community supporting refugees, especially at Polish-Belarusian border, including healthcare support, first aid treatment. Email: contact grupagranica.org. Website https://grupagranica.org/. Caritas, Centrum Pomocy Migrantom i Uchodźcom w Warszawie. Description: an international organization providing complex assistance, including psychological help in Polish, English, Ukrainian, Russian. Adres: Okopowa 55 01 043. Warszawa. Email: caritaspolska@caritas.pl. Website https://caritas.pl Migranci i Uchodźcy 4. Stowarzyszenie Polska, Misja Medyczna, Polish Medical Mission. Description: a Polish humanitarian organization providing medical assistance in the countries facing the greatest need in the world. The association's actions are based on the work of humanitarian workers and volunteers, doctors, paramedics, nurses, physiotherapists, as well as psychologists and medical analysts. They help e.g. Ukrainian displaced people. Adres Batorego 2330 135 Kraków, e-mail sekretariat ipmm.org.pl, website https://pem.org.pl 5. Fundacja Ela Strada, LA Strada Foundation Against Human Trafficking and Slavery. Description: an independent Polish organization established in 1995. They deal with the prevention of human trafficking in all its aspects, from prevention through lobbying to victim support, also through mental health counseling. Telephone: National Intervention and Consultation Centre for Victims of Trafficking in Human Beings, +48 22 628 120. Helpline +48 22 628 9999. Help advice. Email strada.org.pl, website https://strada.org.pl. Spain Local Health Professional Contact. Details Humanitarian Care, Ministry of Inclusion, Social Security and Migration, Government of Spain. How does it work? The Humanitarian Care Programme is aimed at addressing the basic needs of immigrants in situations of vulnerability due to physical deterioration and lack of social, family and economic support who arrive on the Spanish coast or access our country by land through the cities of Ceuta and Melilla. In addition, this also contemplates the development of emergency socio-healthcare services, reception, supply of material to cover basic needs, basic financial aid and transfers. This program is managed by the General Directorate of Humanitarian Assistance and Social Inclusion of Immigration, within the scope of the Secretary of State for Migration, and is financed with its own resources through the general state budgets. The services included in the Humanitarian Care Programme are: 1. Welcome Service. It finances accommodation, maintenance, and other basic care for the final beneficiaries. Includes, among others, accommodation and maintenance, delivery of basic cleaning and personal hygiene materials, clothing, footwear, and a first aid kit. Basic healthcare, information, guidance, advice, and social, civic, health, and legal support. Information about access to other public and private resources. Psychological support, support in re-establishing family and social contact, assessment of personal circumstances and detection of vulnerabilities, and referral to specific care positions according to the needs detected, language and literacy training. 2. Transfer Service. It is responsible for the referral of the beneficiaries of the Humanitarian Care Programme at the entry and exit of the resources, as well as between the reception facilities. 3. Customer Service to large cities. It makes available different resources with the capacity to coordinate care and overnight stays, previously enabled and with a short stay time. 4. Assistance Service to coasts or by land. Responds to humanitarian emergency situations resulting from the arrival of irregular migrants. 5. Social and Healthcare Service in Temporary Immigrant Stay Centres, CTI. It includes information and social intervention, health, psychological and legal care, translation and interpretation, training, leisure, and free time. In addition, it is worth noting the existence of other sub-services that are also part of the Humanitarian Care Programme. 1. Comprehensive Reception Service. It covers the basic needs for accommodation and maintenance and provides the beneficiaries with minimal social tools. 2. Reception Service in Emergency Reception Centres and Referral, CERD. It is articulated as a structural and permanent emergency service. 3. Emergency Reception Service. It articulates temporary emergency devices on an extraordinary basis, reinforcing the Humanitarian Care Programme in the event of arrivals on the coast and/or overcrowding of reception places. Red Cross 900 22 11 22, CAED 807 502 019, Emergencies 112 Contact, Migrations, Ministry of Inclusion, Social Security 913639305, Spain, Migrations, Inclusion, Social Security, Catalonia 93148 Sky. In the town hall of any town in Spain, migrants and refugees are assisted through the Migration and Social Affairs area. Public healthcare in Spain is universal and free. Assessment now. Let's test your knowledge with a quick assessment. Answer the following questions to see how much you've learned. 1. In Cyprus, medical services are provided since 2001 or 2011 or 2019 too. In Greece, the Medical Screening and Psychosocial Support Unit, staffed by EOD personnel, conducts the initial preliminary medical examination. True or false? 3. In Poland, people with refugee status or subsidiary protection are entitled to a range of rights and support, including both cash and material assistance, called an Individual Integration Programme, IPI. True or false? Assessment solutions. Let's review the correct answers to the assessment. Question 1. The correct answer is 2019. Question 2. The correct answer is true. Question 3. The correct answer is true. We hope you got all the answers correct. Thank you for watching. The Health My project is co-funded by the European Union. Views and opinions expressed are, however, those of the authors only and do not necessarily reflect those of the European Union or the European Education and Culture Executive Agency. Neither the European Union nor the European Education and Culture Executive Agency can be held responsible for them.